First of all, a very good evening to you. I hope you had a great day. So before we start with anything, first of all, yes, I would like to know your name as well as it's been how many years you've been practicing.
Dr. Shruti Pandit Kriplani. Have been practicing urology for almost 4 years now, particularly to do with female urology and female urinary leak. Okay.
So especially for females out here, let's start with the first question and question will be based on OAB. Okay, so first question over to you. We can use Hindi, English as well. So can you please describe for the audience viewing this that what is an overactive bladder and how does it impact the quality of life of a patient?
So overactive bladder is nothing but your bladder which is extremely something like oversensitive bladder, where even a small amount of urine in your bladder and you're not able to hold it. You have an urgency, you want to continuously go to the bathroom, you want to go repeatedly, even you're not able to sleep at night because you have to go multiple times. You start leaking urine if you don't go on time. And this has impacted many women as well as men, and this has made them this has socially withdrawn them. They're not able to attend their family functions, they're not able to go on long trips, they're afraid to sleep elsewhere or to spend the night in someone else's house or to make certain long trips. So this is treatable, and we'll come to that.
Heading towards the next question. Why do you think that the patient with overactive bladder delay their visit to a healthcare specialist to get their condition checked out? Is it because they feel that this is not a significant condition to be diagnosed?
So I think the reason patients don't come is because there is a social stigma that I'm leaking urine, and they're embarrassed of that situation, and they're not able to come out with it. And many people, especially women, believe that after some age urine leak is a part of normal aging. I'm here to tell them it is not. A simple example I give to my patients: when in your house you have a bathroom, we all have a bathroom. If there's some problem with the pipeline of that bathroom and your toilet is leaking, when are you going to get it repaired? Are you going to wait for months or are you going to do it immediately? So why do you wait when that pipeline is leaking in your body? Yeah.
Okay, heading towards the last. What are the cons of delayed diagnosis? And also, can you please share us an example where the patient with overactive bladder delayed their visit to the doctor and what was the impact on their health?
So obviously when you're leaking urine, it's unhygienic, you're having infection. Imagine if you are sitting in, there is some dirt in your bathroom, your pipeline is blocked, your bathroom is leaking, and you're sitting with it for years together. What is going to happen? It's going to be quite dirty, it's going to smell, and that entire filth is accumulating in your home. Similarly, when you delay treatment for urine leak, that filth is accumulating in your body, it's causing infection, and in the long run it does affect the kidneys. I have had one patient, one very smart woman who is a single mother who is working. She's providing for 2 of her children. After one age, she started leaking urine, and she works as a primary school teacher. She was very embarrassed that these children are going to know that I'm leaking urine. What if during my class I have to suddenly run to the bathroom? What if I leak? What if it smells? What is going to happen? So much so that she left her job just for this urine leak problem, and she struggled to provide for her family, being the single mother. And then finally when she came for treatment and she got treated, she realized that she should have taken this much earlier. She did not have to leave her job. This is one example. Another example is a patient who came with continuous urine leak, who didn't realize what the problem was. The problem was that the patient was actually holding a lot of urine, and this finally affected this patient's kidneys. See, now once a kidney gets damaged, we cannot bring it back, but we can prevent the kidney from being damaged. Yeah.
Okay, so lastly, one more question I would like to add up. So what do you think, or what is your advice to an individual with an overactive bladder trying to lead a normal life?
So there are some simple things that you can do at home, non-medicational measures which you can do at home to maintain a healthy bladder. First is good exercise and a healthy weight. It has been known that with being overweight does lead to increased urine leakage and overactive bladder. There are certain things which irritate your bladder. There are certain bladder irritants like coffee, tea, chocolates. These are best to be avoided or limited. Next is an adequate fluid intake. When I say adequate, I mean not too much, not too little. The problem is whenever any patient comes and says that I am going again and again, or I have some urine problem, they usually don't visit a urologist. They visit some other doctor, physician. So everywhere they have been giving the same advice that they have recurrent UTI. They are told to drink so much water. And I have had a patient who's having 10 liters of water a day, and she says that she can't sleep in the night because she's going every hour. So I did not have to give her any medications. All I had to do was decrease the amount of water she's taking. So adequate water intake is very important. And especially for women after childbirth, they are initiated on something we call pelvic floor exercises. This pelvic floor is basically a hammock or a jula, which holds the bladder and keeps it and prevents urine from leaking. This entire thing stretches out after pregnancy, and that's what causes urine to leak. So there are certain simple exercises which you can start even before pregnancy to prevent this urine leak.
Okay, so yes, well, thank you very much for such an informative session. It was really nice meeting you. So that's all. Have a great day ahead. Thank you very much, ma'am.